My name is Alaya Chikly, and I'm creator and lover of heart-centered therapy. It's been a commitment of my life to develop this work. As a basic foundation, what we do in the class is that we give tools to be able to address any issue or any trauma or any physical trauma to the body. And how we do this is by first connecting to the heart, because when we connect to the heart, it changes our perspective. The heart only knows how to unify and to heal, and therefore it's in safe ground. If you're in your mind will judge, it'll go into fear, and it'll impede the progress of anyone's process. So when we choose an issue, we will take a moment and think about it, and there will be images and pictures that come up. And as we look at these pictures, there's always emotions that are connected to them. If we pay very close attention, we find that it is actually in our bodies. If we look closer, we know that there's a shape, a color, and a depth, and that it actually takes a viable space in our bodies that affects the quality of the functioning of that area itself. When we do that, if you listen to a sound, you can also hear a frequency which is dissonant, which also has an additional effect. What we do then is we imagine that this area or the shape has eyes, and we connect to them, and we start a dialogue. And this dialogue is very revealing because it has a voice, it has feelings, it has behavior, and it has responses. And in this, we start to discover that this really feels familiar. This is really a part of me and who I am. And if we ask further, when was the very first time you felt this way? You go back to a time when you're a child. And in this time frame, it's very important, because if there is a trauma at that time, it involves other people. Usually it involves mother, fathers, sisters, brothers. It could be other people, but usually it is in families. And what happens is, in this trauma, is there's unbearable pain. And in this unbearable pain, what we do is that we make a decision on how to bear it, how to handle it. And in this decision, usually what happens is that we give up a part of ourselves, we dissociate. Or you could say that there would be fragmentation. Therefore, this is what we call subpersonalities. In the work, what we do is that we bring the parents into this work, and we have a dialogue and a deeper understanding of what was happening. In that decision, we realize that this is when the child gave up a part of themselves in order to be resonant with family. So if you actually look at your family as a child, in your home there is a frequency and a sound. And in this sound there's certain behaviors. And in order to exist in this family, in order to be in that frequency and to be in that sameness, we will create a trauma, we will create a situation where we give up parts of ourselves, where we give up our gifts. And if we support the child to be able to receive that gift back, that so often is such a huge part of the trauma that the rest of the process is easy. So we hold a space for the child to connect to their parents, to have the dialogue, to look into their eyes, and to see deeper into their tragedies, into their pain, and to recognize that they also gave up parts of themselves in order to be one and harmonious in their families. And this is what we can see as we track back through time, that there is an ancestral patterning, that everyone gives up parts of themselves, gives up gifts, and therefore we have strategies in order to be able to survive. And these survival mechanisms could be happening thousands of years ago, 100 years ago, from a war, from a famine, from all kinds of planetary tragedies. So what we eventually end up doing is not only addressing a body component or an emotional trauma, we're addressing the whole family, which is addressing the whole family consciousness, their whole lineage. And if you include everyone that was engaged in this kind of trauma, you have a planetary healing. So on the first level, this is how we address this trauma, and we learn the tools to be able to take it further and address other issues in deeper levels.